Have you ever come across a friend or a family member whose cough just wouldn't stop? Have you ever experienced it yourself? Well, today we are going to talk about chronic cough, especially since in our last bonus episode we mentioned the importance of getting rid of mucus. So, in my practice, I see patients every single week for having the problem of chronic cough. It's super common. This cough, by definition, is one that lasts 8 weeks or longer in adults or more than 4 weeks in children. It can be a wet cough that is phlegmy, or one that feels like there is mucus but just wouldn't come out, or just a completely dry cough. So, what's happening here? How would I help patients like these? Of course, as a doctor, I have to make sure that there is no active infection still producing the cough. I use various metrics like measuring oxygen saturation, and I would also listen to the lungs to see if I hear any abnormal sounds. Most patients also by then would have had a chest x ray done or ready to rule out any serious lung disease. Maybe a CT scan was already done also, ordered by a pulmonologist. The vast majority of these patients do not have any active infection or serious lung disease by the time they are already 8 weeks out. So, what is causing the cough then? The answer is two words: airway sensitivity. When a person undergoes a bad allergy attack or a bad respiratory infection, whether it's bacterial, viral, or both, the airways are subjected to inflammation. Once the infection or the allergy attack is over, the inflammation gradually dwindles over days to weeks, supposedly. However, for many people, this inflammation decreases too slowly, or even worse, doesn't reduce at all. This inflammation sensitizes the airways, especially the fine nerve endings involved. These nerve endings, when triggered, sets off the cough reflex. And these triggers could be as simple as the air movement from talking, the acidity from sour foods, spicy foods, breathing in frigid air, and even the cold temperature of foods and liquids we consume. As you can see, that's why so many people can end up with coughing fits and spasms because the cough reflex is being triggered over and over again. The mucus stuck in the airways can also by itself be a trigger. Okay, now that we understand the extremely common reason behind chronic cough, how do we get rid of this airway sensitivity? The answer, from the conventional medicine point of view, is to use the combination of an anti-inflammatory inhaler plus medication capsules called benzonatate, also known by the brand as Tessalon Pearls. The benzonatate, it activates the nerve endings that trigger the cough reflex. The anti-inflammatory inhaler, plus or minus a bronchodilator, helps to finally extinguish the stubborn inflammation. Now, there are many formulations of these inhalers. Popular ones include beclomethasone, brand name is Qvar, fluticasone, brand name is Flovent, and budesonide, brand name is Pulmicort. Personally, I particularly like Symbicort, which is budesonide plus the long-acting bronchodilator called formoterol. For my audience who are not familiar with medical terms, a bronchodilator is an agent that opens up the airways, allows air to flow through better. In contrast to all of this, I do not see any role for an albuterol inhaler, which is a short-acting bronchodilator. Albuterol, although it's super common, does not help to solve the problem of a chronic cough. By using this overall approach, my success rate for treating chronic cough is extremely high. Over-the-counter cough medications, cough syrups, cough drops, and repeated use of antibiotics are absolutely not useful in this situation. They are a waste of time, money, and resources, and overuse of antibiotics builds resistance anyway, so this is definitely not good. Now, where do I see the role of using Chinese herbal medicine? Well, I find it very useful in situations where patients have chronic cough problems over and over again, despite having each episode successfully treated. For example, someone has a chronic cough, and after using the anti inflammatory inhaler along with the benzonatate, they get better. However, months later, they catch another cold and the cough won't go away again. If this pattern likes to repeat itself, then I add on Chinese herbal treatment to eliminate the sensitivity altogether. This method is extremely effective and is the gold standard in how I treat patients with repeated episodes of chronic cough. This gets to the root of the problem.